Well, good evening, everyone, and welcome to this is our session 2 of designing your program, building a viable program supporting your patients' vision, and importantly, as clinicians, your bottom line. This has really come out of our commitment as Plantrician Project to find partners and information and bring that to you to help translate our passion and the science that we all have encountered into meaningful practices that financially support our ability to continue lifestyle medicine. One of the things I've seen through the years is that lots of people get certified in lifestyle medicine with a lot of enthusiasm. They go back into their practice without the necessary tools, and they find it extraordinarily difficult to marry their passion with the daily practice and that important component of developing a consistent revenue model. So we are passionate about bringing you information. And as a part of that, we have partnered with our dear friends at ProNex. For those of you that don't know us or me, we are the Plantrician Project. And this is a not-for-profit that was started in 2013, really around the passion for empowering, equipping, inspiring, educating, and coming alongside healthcare practitioners and health enthusiasts around the world with the science and the tools to take whole food, plant-based nutrition and lifestyle medicine to your families, to your practices, and to your communities. We host conferences. We have a number of free resources, plantricianproject.org. And in our process of helping people, we come across amazing partners like ProNex. And in just a little bit, I'll let Karol introduce ProNex. But we have partnered to bring you this multi-session webinar to help you gather the resources that you need and the tools so that you can begin translating your passion and science into your practice. So we're delighted that you're here. And I'm going to pass it over to Karol to introduce ProNex and take us into our evening. Karol?
Very good. Thank you, Dr. Stoll, and welcome everybody. I'm excited to be here for week 2 and to be one of the people who is representing ProNex. Value our relationship with Plantrician so very much. And we obviously have Deepa's working with us as well. We have a number of lifestyle medicine practitioners, but we also have just met a wonderful group through Plantrician, and we value that so much. And one of the things about ProNex is some people may wonder what exactly is ProNex, but ProNex is actually a software company that actually is way more than that, though. It's been around for well over 2 decades, providing solutions for practitioners in the obesity medicine and disease management fields for their patients. And a number of years ago, we started really focusing on lifestyle medicine because that was an area with a big need. And many practitioners have difficulty, as Dr. Stoll mentioned, delivering, prescribing, and tracking the 6 pillars of lifestyle medicine. And so we built an entire platform around that. So it's not only an EMR, it also gives you the tools that you need to bring your patients in from whatever digital door that you have, track your leads, but also have a full EMR and full lifestyle medicine functionality to deliver your care. And it also has a very robust patient platform where patients can take pictures of their meals and you can interact back and forth, giving them their prescription, and then they in turn end up uploading their response and their actions that they take for everything that you prescribe for them to be doing. It also tracks GLP-1s if that's a part of your practice. And it's just been a joy to bring this platform to practitioners as an all-in-one solution for them to be able to effectively deliver lifestyle medicine. So we're not really here just to talk about that, but I wanted to make sure we made that clear because I think we did get a couple questions last week just to have a little bit of clarity around that. So thank you for giving me the opportunity to do that. And without further ado, we will go ahead and get right to the program tonight, because tonight is so exciting. It's actually where we help. Last week we talked to you about getting stuck to starting, and this week is all about designing your program that's going to be ideal. And Deepa's going to go into a bit about the different settings, and we'll get into some of the details. And at the end, just like last week, we'll have a very simple, not overwhelming homework sheet for you to actually implement this in whatever setting that you're in. So this 6-week series was created with you in mind, with practitioners in mind, and from the feedback that we've received from so many. So we started out with from vision to visibility. This week is designing your program. Next week is all about attracting your ideal clients and some of that marketing that we all need. And then we're going to get into some of that intake to long-term adherence and patient compliance, and then really talking a bit about scalable revenue models at work and metrics that everyone needs to be monitoring in their practice or their setting. And for tonight's agenda, really, it's just a quick recap from last week. We're going to go through all the things listed on the screen, the common barriers to program development, the importance of designing your two pathways. People sometimes just think it's the patient pathway or the client pathway, but really it's the whole pathway of what they go through in your entire program and your services. Building a practice model and ideal patient profile, defining your transformation and that blueprint that we're talking about, and then that little bit of homework that I mentioned. Last week's progress, we talked about your clinical why. Hopefully everyone did their homework and wrote down, what was it that brought you to lifestyle medicine, your practice why, what is it that you are creating, no matter what you're setting, what is it that you want for your life and for your patients in your practice. So we have to build this all around that holistic vision, and then making sure we get people a lot of times stuck in, I've got to get more credentials. We went through all of that last week, and we kind of gave everybody permission to not have everything perfect to get started or to scale your practice onto something bigger. I won't go into this too much, but we've curated a support team that is here every step of the way, and we are also available to help answer any questions. And we wanted to bring in expertise from people who are not only have that knowledge, but also are in the trenches, just like you, in practices and in programs and running them. So that's the team that we've curated for you. And we're going to dive right in. Right now, I'm going to hand it over to Deepa to start into our content for tonight so we can get into the exciting part of your program development. So Deepa, take it away.
Thank you, Carol.
Sure.
So last week we introduced two characters because we decided, this series is going to flow as a story because it really brings together mine and Carol's and Dr. Scott's personal experiences in this space, and we just want to use that as to leverage and provide the knowledge and the support you all need to carry your dreams forward. So the Maya represents the health coach, dietitian, healthcare provider, and then there is Dr. Marcus, who represents a physician. Now, Maya and Dr. Marcus may be working in a variety of different settings. They may be having their existing practice, or they want to start launch a new practice. They may be part of employee wellness program, or they want to start an employee wellness program. They have passion for food as medicine, culinary medicine, and want to start a lifestyle kitchen center. Or you could be part of an healthcare organization like an FQSC or a community organization, where you see the need to start delivering lifestyle medicine. So no matter which setting you are in, the underlying foundation remains the same. Okay, so, and that is what we are going to discuss in today's module. Next slide, Karen. Okay. So many people, we sometimes get frustrated because we try to do a lot of things at one time. Based on, again, our own experiences, we feel that these are some of the common barriers that slow program development, and we will go through each one of them. Trying to serve everyone. When I started, I felt, oh my God, I have to I should start a program for obesity, for diabetes reversal, cholesterol, hypertension. I should start in Spanish and English and few other languages. And it was all at one time. By the way, the settings that I mentioned, I have pretty much worked in all those settings, and I continue to work in all those settings. I work at a FQSC, I work in the community or with a community organization, and I have my private practice. So I understand the nuances of working in different settings. Going back to the common barriers that I have seen uh, can hinder the process is that perfection trap that we talked about last week. Oh, I need to have this, I need to have that. Now that doesn't mean you start haphazardly, but we have to start somewhere and make sure that we have enough things for the foundation. If you have credentials, if you have population, uh, then and few basic strong tools underneath you, then you are ready to start the program development. You cannot get stuck into that perfection trap. Overbuilding before testing, coming from my personal experience here again. We wrote the grant without really uh, thinking about how we were going to execute. That was in 2014. Okay, and we got the grant, and then we realized, oh my God, in that grant we wrote we are going to have kitchen, we are going to have this, we are going to have that, and we built it before testing, and it was one very hard first year. So that mistake we should never do it. We should have at least started with a small group of people to test it and see, and so on and so forth. Not getting organizational or partner buy-in is a big one, especially if you are working with an FQSC or any community organization. So you might want to start with the business model from the top down. Okay, unless you have a business model in place, the organizations are going to be very hard to support your cause. So if you are a part of organization, I would suggest that you start from the top to bottom, because the decision making process does take time. So while they are thinking about things, you can start working on building the other pieces together. The tool software fatigue or mismatch, what does that mean? Uh, Another personal nugget here. When I started practicing lifestyle medicine in my private practice and at my FQSC, I did not have a proper software solution to capture what I was doing. Okay. The one that I had, which is like, the big EMRs, they are not designed to deliver or the lifestyle medicine related outcomes, or to deliver even the content and provide the in between appointment support to the patient. I left so much data on the table. It was unbelievable, because if you're into, or if your financial model depends on outcome, which most of the time it is, then you need to make sure that you have a proper tool to to capture those outcomes. And so that, and then if you're an individual provider trying to again do things on your own, then you are going to evaluate so many different tools and EMRs and this and that you get fatigued, and you say, oh, you know what, I'm going to start with something, something, and it may not have other all the functionalities I need for lifestyle medicine, but it provides me with the basic EMR, because you are making that decision out of fatigue. So be aware of that. Another barrier is lack of clear offer or program structure. You can start with 2 patients or 1 patient, but have a roadmap, have a structure in place, and clear offering. And we will be talking about how to put the clear offer of or program structure together later on, but as well as next week in our marketing program. And then there is the waiting trap. Oh my goodness. The reason that you all are here, probably because you have been waiting for a long time to get started, and I hope that wait would be over by the time we are done with this series. The waiting trap is absolutely the most torturous one, and I'm not saying to like again rush and launch. That's not the point. But don't wait for for everything to be perfect and all the components to be together. Now, the designing your program is really you requires some soul searching and due diligence. Okay, whether you are whether you are part of the organization or you are on your own, whatever your background may be in terms of who you are, a coach or a doctor or a surgeon or you have to chart out what your patient or user journey is going to be, and then on the practice organization side you have to chart out how that building or that journey is going to be. So let's the program design involves understanding who do you serve, who is your patient population. You may have patients with all multiple chronic disease conditions. In the beginning, when you are starting, identify the one area and start with that. What problem are they trying to solve? Are you in an area where they don't have access to the basic food or groceries, or you are in an affluent area? What is the problem we are trying to solve? Because your program components uh, are going to rely on the problems that the very problems that you are trying to solve. So if there is a food insecurity issue, then you can't have recipes and videos about how to shop at Whole Foods. Okay, if you are going to if you're working uh, on women's problem, then you need to make sure that you have components to solve those issues. What transformation do they want? uh, Karol can talk about it next time in the marketing, but it's very important to understand the patient's desire, what and their why. How will they enter the program? Extremely important. When I was at at an FQSC, we didn't have a person to enroll people in the program, and that was a big problem. That was a big barrier. So how will they enter the program is the recruiting part of it, and how will they stay engaged? Even more important, whether you have one patient, 100 patient, 500 patient, or 5,000 patient, they are major stakeholders. They are going to go out and talk about your program, your organization, your success, and all that is tied to the revenue model. So it's extremely important that you stay engaged. Everybody stays engaged during the program, but we are talking about after the program is done. Does your program provides or supports that engagement in a meaningful way? Okay, so that's the patient journey you have to take into account when you're designing the program. On the provider side or on the organization side, it starts with who are the decision makers. You may be a solo practitioner, you may have a partner, you could be part of, again, a community organization, you may have a board. If you are a faith-based organization or FQSC, even or a hospital, identify the key decision makers, who are the champions, and most importantly, the business model. How will it get paid? How will the program be delivered? What systems and support are needed? Next slide.
So as you're designing your practice model, that what Deepa just reviewed is probably a very important aspect of it, and only because I know when I work with practices, a lot of times as they are struggling, we'll go back and we'll look at their patient pathway. Was it well designed? Does it wow their patients? Does it keep them engaged? Does it have them telling all their friends about it? And from the practice or the organization side, it's so easy for a practice or a program to fail if there aren't all those pieces in place. So it's not meant to overwhelm, but it's just such an important piece of that whole aspect of setting up your program. Because later on, if things, and it'll always happen, things won't be going quite the same way. You actually go through every step of that and evaluate it. And that's where your answers come from in terms of what needs to change. And when it comes to designing your practice model, this part here is not a checklist. This is really building blocks. So it expounds a bit on what Deepa just talked about, who it is that you want to serve. Is it midlife women? Is it teenagers? Or is it athletes? Is it, who are the people that you want to serve the most? What are their major health challenges, their goals, and what are their biggest frustrations? We'll get into that a little bit more, like Deepa mentioned, next week when it comes to marketing, because those things are what is going to help attract people to your practice, your program. And for where you're going to offer it, it's like we've talked about it last week. It's never been as easy as it is today to have either a virtual or an in-person or a hybrid model. And so it provides you with so many great tools in order to be able to provide your to design your practice model. And so this gets back into your vision. It builds on what you did last week about what do you want your practice to look like. One of the major things is how to get paid. Oftentimes, as clinicians, I mean, really, the financial side is not a big part of any of a clinician's training, our training. So we're all about helping the patient, of course, and that's what's most important. But that cash, that how that's going to run, is it cash? Is it insurance? Is it a hybrid? Are you going to have other revenue streams coming in? So those are things that you want to look at when you're designing your overall practice model. And then how is it going to be delivered? And through all of these, whether you're going to do one-on-one, group, or shared medical appointments or membership, however you're going to do it, you want to make sure that you have the tools in place, which is where, oftentimes your software comes in, but not only that, your people and then the systems that you're setting up. So we want to make sure all of that builds. So this, like I say, is not a checklist. It starts with who, where, how you're going to be paid, how you're going to deliver it. And then it's a matter of developing that plan, implementing it, and then offering it to a small, group of people so that you can test out your whole program practice model. So that's the things that we need you to answer. So as you go through, you probably are thinking yourself already, what is it that you want to be doing? And that's it's very key to identify early on.
So, is there a perfect model? No, there's no really a perfect model, because you can have a variety of combinations and permutations to make it a success based on your work settings. You can have virtual, in person. Usually organizations have it virtual and in person. It can be cash pay, it can be insurance, it can be hybrid, coupled with grants or outside funding. It can be membership model. If you already have existing practice, and if you're in lifestyle medicine, we all know the business model, the revenue for lifestyle medicine practitioner sits on top of shared medical appointments, either with a practitioner or in a multidisciplinary uh, setting. So that I think next week or maybe week after, we are going to have a billing specialist, a company who is going to give us an overview of the revenue model for share medical appointment. It is, I cannot tell you the benefits of doing share medical appointments, specifically as it relates to lifestyle medicine, the group support, the individual visits, all that can be grouped under shared medical appointments. So again, there is no one right model. However, systems are essential for optimal outcomes, engagement, RCM, and profitability. One thing we want to make sure that whichever model you choose, and how small you start, whether with one patient or 10 patients, we have to think about the long-term scaling of that model. Do not start with Excel sheet and say, oh, somehow I'm going to change it and scale it off of that. The scaling part should not focus on building the blocks. Build the foundation and then go after scaling. Next slide.
So when it comes to programs, we're going to get into this more next week, so I won't spend too much time on it. But the bottom line is, let's say you've developed your program, you're so excited, you have your first offer, your program that you want to start promoting, and you're thinking, how am I going to get this out to people? So often as clinicians, we tend to sell features to people. So we feel really good about the fact that they're going to get this many lab draws, they're going to get this many different tests, we're going to have this many different appointments, they're going to get this many handouts, this many videos, they're going to get this membership. We get into all that sort of thing, but really what patients buy is the outcome that they desire the most, that transformation. So whether it's weight loss, energy, confidence, lower A1C, learning how to eat healthier, how to eat plant-based, that's what they're really looking for. So whether when it comes time, as we get into the marketing and other aspects of this program, whether it's on-site or a flyer or that sort of thing, if it reads like a spec sheet, just where it's like, this is what you get, because we want to reinforce why that price is there or why that sort of thing, it's not going to work as well. A 12-week program that sells features is not going to work as well as a 12-week program that helps them actually gain the outcome that they want. So this happens in your marketing, it happens on your website, it happens on your flyers, and it also happens in person when you're talking to a person about your program. You want to feel so strong about your program that you don't want somebody to stop their conversation with you until they're signed up, because you know it's the best thing for them to get them the outcome that they desire.
So I just want to kind of emphasize the importance of starting small. If you are, no matter which setting you are in, starting, however, with the mind, the program can be a beta testing program, but the mindset should be about scaling. And that mindset will come in extremely handy when you are talking to the stakeholders, when you are trying to get your organizations buy in on it, because if they see revenue along coupled with plan to track the outcomes, the improvement, the grants, that potential grants that your organization, or even as an individual providers, there are some grants available out there, uh, and a roadmap and a infrastructure to support it. That's the secret to building a program or a model that is going to flourish.
Right. Dr. Stoll, did you have something to add to any of that about starting and scaling, or any
Yeah,
aspect?
I would just simply add that, as I said last week, I started doing this more than 20 years ago without any of this information or tools or resources, and I learned a lot of these lessons the hard way. I was remembering the hard lesson of selling features rather than meeting somebody where they are with what they're interested in, selling them information rather than listening to them, building something big and trying to get it perfect rather than starting simple, testing it, modifying it, and moving forward. So I made a lot of the mistakes that you're talking about in this program. And I think it's incredibly valuable for everybody that's on this journey with us over the next remaining 4 weeks to get this information early on as you're building your practice. I really can't reiterate how valuable this information is, because this is really the distilled, successful program foundation that has been tried and tested by myself, by Deepa, and lots of other people. So I guess I want to compliment you all on putting together such a powerful deck.
Thank you.
And then, Carol, I just want to include one thing, that a lot of practitioners are getting into lifestyle medicine practice, and the mindset that we need to have if we are into lifestyle medicine is no different than how intentional the current medical system is about medication. Okay, they prescribe, they track whether the patient has taken the medication or not, it is almost in a very prescriptive manner. Unless we start looking at the 6 pillars and break them down just like pills every single day in some sort of a systemic manner, similar to prescriptions, the patient is not going to stick to it. Okay, so if you are just sending handout, if you are just having them read a book and doing a webinar, that is not translating into long-term compliance and long-term outcomes. Now we have come out of this, I call it honeymoon period with lifestyle medicine. Oh, it works, and everybody's happy. Yeah, first 3 months, and then the reality hits, and 1 year, after 1 year, you follow the same patient, and he's back to you know where. So, we want to change that, because at the end of the day, we are all trying to provide or change the public health or solve the public health issues. And therefore it is important that when you are designing your programs, you have that in mind. Don't just go after nutrition protocols and just handouts and just resources and more uh, hard heavy to read, hard to follow kind of educational material.
Right. That's a great point. Um, And what we have for you tonight is really taking what we just reviewed, who you're going to serve, where you're going to serve them, how are you going to get paid, how you're going to deliver this, what transformation are you going to provide for your patients, and then coming up with your first offer, that first program design. The homework sheet for this week, Deepa's going to put it in the chat, actually guides you through that whole process. And on some of our future calls, it would be great too. We'd love to have some feedback from you about what you wanted to create. You know, we'd love to have a couple of potential hot seats and kind of go through that if somebody's willing to do that. But that would be the homework for tonight, is really to look at what it is. And even if you already have your program, then it's a matter of looking at what it is that you offer and how might you want to be changing that. What's meeting your patients' needs, what's not, what is a frustration for you or for your patients, and then how can you revise that whole process from a patient pathway and your program pathway to make that something that's more impactful for them. If there's somebody out there who is starting their first brand new practice, so you're just starting from scratch and you're like, I'm not even sure. I know I have to have a name and I have to get, corporate document. There's so many things. We did put together just a quick checklist for somebody who's brand new but setting up an entity. We're not pretending to be lawyers or someone giving that advice, but these are the things that you have to think about to set up properly from the very beginning. So Deepa's going to put that link in there too if you wanted to download that checklist. It's just there as a potential guide so that you're not missing any aspect of setting up a brand new practice from scratch, because obviously there's a lot that goes into that. I mentioned to you the homework for next week, and that's in the in the chat there, along with if somebody really wanted something, the checklist for starting from scratch. And we want to keep the momentum going. And as Deepa was just talking a moment ago, I guess I got a little bit so excited because fortunately for us and for lifestyle medicine practitioners, Deepa has had her hand in every aspect of the core LMP EMR development, so that it does allow a practitioner to deliver care in the manner that she described. So it's kind of exciting. But no matter what tools you're using, those are the principles that need to be in place and that we encourage you to really think through and have that as a part of your practice. Deepa or Dr. Stoll, did you have more that you wanted to say tonight about anything? Have any questions or?
No, I would just ask if there's any questions real quick as we close up in the chat. I don't think I see any questions, but if you do, you can either raise your hand or throw a quick question in the chat as we wrap up. And again, we will be here again next week, same time, same bat channel. And we are appreciative for those of you that are joining us live and those of you that are joining us on the recorded video. And these are recorded, so if you're here live, you can actually go back and rewatch this to get some of the details that were part of this presentation.
Awesome. And we'll be sending that out along with those same links that Deepa put in the chat. We'll be getting that out in the next day or two to you. So, and yeah, I appreciate everybody who's here and those that are listening after the fact.
Yes, thank you everyone for joining. And on behalf of ProNex, Karol, Deepa, and Fred, and the Plantrician team, we are delighted that you're here with us. Thanks for spending a little bit of time with us this evening. I know this was a valuable evening, and this information is the right information to help you get started. We will look forward to seeing you next week. And until then, have a wonderful and blessed July 4th celebration. Thanks, everyone. Have a very good night.
Thank you.
Bye.